This is the framework that we have and that we're using within Sanofi for promoting our patient centricity. If there's only one slide that you should pay attention to, this is the slide. And essentially the way that we've thought about it is every project, every program, everything that we do should really tie to this. Now this was presented, we call it the donut slide within the organization, but the way that I think about this conceptually is as overlapping Venn diagrams, because all of these activities actually should inform one another. So first we have input and understanding, which is really bringing in patients so that we understand what their conditions are. And I'm not talking about market research where I might have a widget that I have decided is very effective and I want to do the research to decide how to market it, how to talk about it, how to bring it to somebody, but to really start with the blank slate of what our patients needs and then to think about how can we meet those needs with a real understanding of what are their priorities. Second is solutions and outcomes, to make sure that we take those insights, we take that understanding, and then we are able to utilize it in order to improve patient outcomes, but then also to make solutions that fit into their lives. So I often tell the story as a pediatrician, I've taken care of thousands of children with strep throat, and I never ever prescribe penicillin for my patients. Why? Penicillin is a drug that is given not only 4 times a day, but every 6 hours. So if you are a parent with 2 kids in school and you have a job and you have to give that medication every 6 hours, are you going to do it at 6 in the morning, and what do you do at noon, and then at 6 o'clock at night, and then you have to wake up your kid in the middle of the night? What are you going to do? How are you going to manage that? As compared to amoxicillin, which is 3 times a day, and you can do that in the morning, after school, and over dinner. So the difference from a biological perspective between amoxicillin and penicillin is minimal. And I would say that we as a pharmaceutical industry have focused on the biology. But the difference between 4 times a day and 3 times a day for giving an antibiotic to your child can make all of the difference in terms of adherence and getting that child better. And so this is where I think we need to focus in terms of the solutions that fit not only from a biological perspective, but just make sense and fit into patients' lives. And then lastly is the focus on culture and community, which is really making sure that everyone in our organization, whether they're industrial affairs or regulatory or HR or finance, medical affairs, understands that what we are doing should impact patients and that what they need to do is think about how they, in their work and in the context of their work, are able to have a positive benefit on patients' lives. Frankly, I found that when we were at PCORI, it was very clear that we were working for patients, and it was an incredible motivator for our employees. And so this is actually one of the pillars that our leadership is actually very interested in, because they really want our employees to be very motivated and to understand how we are truly working to be a patient-centered organization.